Well, greetings, everybody. Welcome to the biweekly Safe Passage for Children webinar, and I'm happy to have all of you here today. I would say before we get started, I want to take care of just a couple of quick business items. First, as you know, if you've attended any of these, I usually announce what's coming up next. The next webinar 2 weeks out at this point, but our presenter for 2 weeks developed a scheduling conflict, so I'm currently trying to find someone to move into that time slot, maybe switch out from another time slot. So I don't know, frankly, at this point, that's going to work. So just watch your emails from Stephanie and you will see if we do have a webinar at that time. And as usual for today's webinar, we're going to have a question and answer discussion segment following Dr. Luciana's presentation. But in the meantime, just feel free to post questions or comments in the chat box as we go, and we'll address them when we get through the presentation. And as usual, we ask you to mute yourself, but we also, if you don't mind, if you're willing to turn on your camera so we can, because we like to see who all is with us. So with that, I'm very pleased to introduce Dr. Monica Luciana, who is the Distinguished McKnight University Professor, the Starke Hathaway Professor of Clinical Psychology, and the Chief Scientific Officer of the Masonic Institute for the Developing Brain at the University of Minnesota. And as I said in some of our material was sent out to you in advance. This is an enormous new resource, a great new resource for the state of Minnesota. We're so lucky to have it. Dr. Luciana will introduce us to this institute, which has brought together experts from across the U of M. They're doing cross-disciplinary, community-focused research and clinical work. The architectural environment is unique because they've taken the building and reconfigured it to maximize people working across disciplines. And there's a focus there on development from all the way from early childhood through adolescence and into young adulthood. So hopefully someday the Institute will be giving tours and we can see this physical facility for ourselves. And I look forward to that. So with that, Dr. Luciana, we're so honored to have you here today and very much appreciate you taking the time to be with us. And with that, I'm just going to turn it over to you.
Okay. Thank you. Thanks for having me today, and thanks for that nice introduction. Do I sound all right? Can you hear me okay? Yeah, all right, good. I should tell you all, I'm getting over a little bit of a cold, and you can probably hear I'm a little raspy, but hopefully we'll be okay, and I won't need to take any little breaks to cough. I've been at the University of Minnesota for a long time. I actually came here several decades ago to attend graduate school. My background's in clinical psychology, and as a postdoc, so really soon after I got my PhD, I developed more of an interest in developmental questions and research. And so my current research program focuses on adolescent behavioral and brain development and the intersections between the two. So I've been involved with developmental research at the university for a number of years. And it was really because of that work that I was invited into my current role as Chief Scientific Officer of the MIDB. I've been in that role for only a couple months now, and in some ways myself am getting oriented to how things are working over there, but I hope that today I can give you a nice overview of the facility and the programs that are housed within it, and some programs connected with it, but not necessarily housed within it. So what you can see on screen, hopefully, is an aerial view of the Institute. This is the former Shriners Hospital space off of the River Road between Minneapolis and St. Paul. So it's just maybe about half a mile from the medical school area of the university. And I can tell you a little bit more about the space as we go along. So I thought I would just start by sharing a little bit about the mission statement of MIDB. As an institute, it is dedicated to the idea of fostering healthy brain function for children across the lifespan. Although I say across the lifespan, the focus of most of the work that is going on over there now is focused on the period from actually prenatal life and the early newborn stage through adolescence. So we do have an interest, of course, in following people into adulthood, but the focus is on really the earlier parts of the lifespan. And we are interested in understanding more about the brain's ability to be flexible in the context of various circumstances that an individual might encounter in the course of life, and how we can sort of leverage that flexibility and potential really of each young person to achieve health and success in life. So the work that is ongoing over there is focused on basic science, focused on translation, you know, kind of like a bench to bedside kind of orientation, how to prevent adverse outcomes from occurring, and how, when intervention is needed, how we can best structure those interventions to take advantage of kind of where people are at a given stage of development. So neurobehavioral development is a focus, mental health assessment is a focus, and as you might imagine, because we're interested in those things, we are also very much interested in policy work of the type that you all do, advocacy for children, and promoting community education, and maintaining a climate of cultural sensitivity is a major priority. So what MIDB has done is to provide opportunities for scholars across the university and really across the metro area, because not everyone's at the university, to kind of come together and be able to share resources, integrate their approaches and their talents. And what we very much want to do with this new space and infrastructure is to encourage new collaborations. And those collaborations might be at the level of research, they might be in terms of clinical care, or community-based kinds of programs and policy development. So I thought I would tell you a little bit about the Institute's placement within the University of Minnesota. So it's an interdisciplinary institute, as I mentioned. It's technically part of the Office of Academic Clinical Affairs, that is abbreviated OACA, OACA, and led by Jacob Tolar, who's the Dean of the Medical School at the university. And so the Institute operates as a joint venture between OACA and the College of Education and Human Development. The College of Education and Human Development is where departments like the Institute of Child Development and Educational Psychology are located. The Institute is named for the Minnesota Masonic Charities because they gave a very large gift in support of the Institute's development, and hence that honor. And the Institute was approved by the regents of the university in June of 2020. So not very good timing in terms of the pandemic, but what the pandemic has allowed is for these last couple of years to be focused on the building, the infrastructure, and getting a number of programs kind of up to speed. We have had a series of grand opening tours. There was a plan for a grand opening celebration to take place. It was originally scheduled for October of last year of 2021. And around that time, the COVID case rates started to escalate, and masking regulations, which had been lifted at the university over the summer, were put back in place. And so the grand opening celebration that would have invited many stakeholders to the Institute was canceled. We're not sure what the plan will be for rescheduling that, at least on a large scale, but we are actually currently offering tours. So if this group would be interested in a tour, that is definitely something that can be set up. So, and then, you know, here are pictures of various groups that have toured. And then in March, we had the Masonic Cornerstone dedication event, which I think between March and today, it was probably the only nice day we've actually had here in the Twin Cities. And it was a very interesting kind of celebration to dedicate the Institute. So I mentioned that the Institute is funded largely and actually administered through this collaboration between the medical school at the university and the College of Education and Human Development. There are a number of other kind of entities that reside within each of those overarching spaces that are major intellectual and kind of day-to-day practitioner participants in how the Institute operates. So for example, on the medical school side, which is illustrated here in the kind of pinkish purpley color, we have child and adolescent psychiatry, which is a unit of the mHealth system that and the university faculty system, which has moved into this building in its entirety. The Center for Magnetic Resonance Research, which is the institute on our campus where MRI research takes place. They are collaborating heavily with the Institute. We have a functional MRI scanner in the building to allow for research scans to take place. And so the CMRR has oversight over that scanner. The Department of Pediatrics moved many of its offices and clinics into the Institute as well. And then on the CEHD side, we have a number of faculty from child development who are involved in the operations and governance at the Institute. And then there's another entity called the Institute on Community Integration, excuse me, and they have also moved in. The clinic is managed by the mHealth Fairview system. Let me just pause for 1 second here. Very sorry. Okay, so one thing that is unique about MIDB and about housing all of these entities in one place is that it allows for quite a bit of crosstalk across units, across faculty, and importantly, crosstalk between the clinics and the research operations. And that is something that really, it's not that it hasn't existed at the university, but it hasn't existed all under one roof. And we have high hopes for those kinds of integrations, and especially integrating researchers with clinic operations. We hope that we will be able to do more to encourage mental health and behavioral health of our children. it's a good time to do this, given the status of the various entities at the university that are contributing to this effort. Our Institute of Child Development is the #1 ranked institute in the country. Our imaging capabilities at the U of M are world renowned. People come here to the university only because of those resources and because of the kinds of research that they can do. And then the mHealth Fairview system is the largest provider of mental health and addiction treatment services in the upper Midwest. So again, there's just a lot of potential in bringing these entities together. Even though I have focused so far on the contributions of the medical school and the College of Education and Human Development, I think it's important to mention that there are a number of other units on campus that contribute to the activities at MIDB. So really, the reach of this institute is pretty far in scope within the university. So we have faculty who are affiliated with the School of Public Health, the School of Nursing, College of Liberal Arts, which is where my department is located, and then various institutes and centers on campus that are doing relevant research. And then we hope to be able to encourage student training through collaborations with several of the graduate programs on the campus through these participating departments. The leaders of MIDB, there's a co-leadership organization. The leaders are Damian Fair and Michael Georgiev. Damian Fair is the Red Leaf Endowed Director and has a joint faculty appointment in the Institute of Child Development and in the College of Education and Human Development. And then together with an appointment in the Department of Pediatrics. And then his research is focused on using neuroimaging methods to study developmental problems, actually from like preschool age into adolescence. He's very interested in methods development for imaging, but also in bringing this work to the community and engaging community groups in the kinds of research operations that we do. Michael Georgiev, who is an MD, is the co-director, and his primary appointment has been over the years in the Department of Pediatrics at the medical school at the university. He is a neonatologist, and his research program is focused around healthy nutrition and nutritional interventions that can encourage healthy brain development from infancy into adulthood. And so his work is translational in nature. It involves both animal studies, but also bringing what we learn from animal research into human trials. And one of his areas of interest, for example, is in iron deficiency and the impacts of iron deficiency on neurodevelopmental processes, and how then treating children with iron supplementation can help kind of ward off a host of problems. So together, these two bring a range of complementary areas of expertise, and expertise with different phases of the child lifespan that together can kind of serve our various communities. And then we have an operational leadership structure that I'm part of. So I'm the Chief Scientific Officer. So I'm responsible for helping to kind of develop and put into practice the scientific agenda for the Institute. We have a clinical research director or coordinator, Neely Miller, who runs our Center for Neurobehavioral Development. John Stedland is a chief administrative officer. And then we have a clinic coordinator who kind of helps us to integrate all of the research activity that we are doing with operations in the clinic. So we do have a few areas, I think, of particular strength. And those areas of strength are derived from the kinds of work that our faculty are bringing to the Institute, and then the sorts of questions that are being asked. So in particular, we have a lot of expertise in very early life. So the first 1,000 days of life, this would be starting with conception, so going through the prenatal period into neonatal development, and then into like the toddler age. So we have a number of large-scale studies going on at MIDB that focus on this part of the lifespan. We have expertise in the preschool period. And then it's not that we don't have anybody studying middle childhood, but we do. But we then have a number of research projects focused on adolescence. So we're always looking for ways in which our areas of research and our research portfolio can grow to encompass that full range of development. So again, we are focused on encouraging collaboration to allow that to happen. So I want to just tell you a little bit about the space. We have clinic space, and it's space that's designed for flexible and collaborative care, but also it's a space that encourages training of both MDs and psychologists in training who are learning how to work with children of different ages. So the clinic space is set up in a way that is geared toward, on the one hand, to some specific populations. So we see a lot of children, for example, who are struggling with conditions like autism, and there are special spaces over there that are designed to be kind of lower stimulation in terms of just how they look, where they're placed within the clinic itself, and allowing the family to sort of navigate their clinic visit without having to necessarily encounter a lot of other people or anything that might be disturbing to the child. And autism is not the only example of that, but it's one example. And then we have observation rooms that allow clinic visits, if the family says it's okay, to be able to be observed by trainees who are learning themselves how to examine children, how to ask questions. But again, the trainees can observe the interactions in a way that's not threatening to the children or parents who are there. So we have some rooms that are dedicated more toward infants, others that are more, kind of friendly for slightly older children. And again, state-of-the-art kinds of tests and equipment and ability to collect biological specimens, things like that, that will enable care to proceed in the best possible way. Our hope ultimately is that we can encourage clinic patients to take part in research. That is not anything that's going to be obligatory to people who visit the clinic, but we want to set things up in a way that allows people in the clinics to at least know about research opportunities that might be available to them. So right now, what we're working on is a way to provide that information to families in a way that's easy and kind of quick for them to access. So not where they have to sit and like read through a lot of material on site, but we're looking into electronic interfaces that will allow us to engage in those kinds of communications. So here on the right-hand side, I've listed some of the clinic specialties that exist at MIDB. This is not an exhaustive list, but it at least gives you a sense of the kinds of things that are over there. So I already mentioned that we have a clinic that's dedicated to autism spectrum disorders. Our child and adolescent psychiatry clinics are over there. As a branching of that, but kind of different from that, we have a developmental behavioral pediatric clinic as well. There's a NICU follow-up clinic. So that's one that's actually been at the university for a number of years and is in the midst of long-term, like into middle childhood and adolescent follow-up of children who have had a need for neonatal intensive care treatment. Many of those children are preterm born infants, for example. And then pediatric neurology, pediatric neuropsychology, and pediatric psychology have all moved over to MIDB for their clinic operations. So hopefully you can kind of look at this list and appreciate that there's a lot of overlap in the kinds of populations, but also services probably that would be offered children. And so whereas the prior model had these clinics kind of siloed in different areas of the university, one advantage to having it all together in the same overarching space is that the clinicians have an opportunity to interact more with one another than maybe they otherwise would have, and to then use those interactions for consultation and collaboration around individual cases. So we hope that through this collaboration and consultation that individuals' care will be enhanced. We also have one-of-a-kind research opportunities. So I mentioned that we have a clinical research coordinator. We have a center that has been at the university for quite some time, the Center for Neurobehavioral Development, that also has now moved in its entirety into MIDB. So we have then a dedicated research space. We have a lot of technology that allows us to engage in cutting edge developmental research. Part of that technology, as I mentioned, involves neuroimaging. So this is a picture of the MRI scanner that is housed at MIDB. It's a 3 Tesla scanner, similar to what you might encounter if you had a clinic visit and had to have a scan. We also have facilities there for behavioral assessment, many different types of behavioral assessment, assessments of things like physical stature, height, weight, sensory function, other kinds of brain activity. So we have 2 high-density electrophysiology systems through which we can measure brain activity across the entire surface of the scalp and skull. We have facilities for biological specimen collection, and then a number of service cores that will enable researchers to take advantage of all of this equipment. Just gonna go back for a second. I'll mention this a little bit later too, but the researchers at MIDB, including myself, are affiliated with several large national consortium studies that have been funded by the National Institutes of Health within the last 4 to 5 years. One of these is called the Adolescent Brain and Cognitive Development Consortium, or ABCD for short. Another one, newly funded, is the Healthy Brains Cognitive Development Project, or HBCD. ABCD is following across the country 12,000 adolescents from age 9 all the way into young adulthood, and assessing almost every aspect of their development. The HBCD project is enrolling mothers who are pregnant and who are agreeing when they're enrolled to allow their family, so themselves and their to-be-born infant, to be followed through that infant's childhood. And so together, these studies will cover the period from prenatal life all the way through into young adulthood. The HBCD study is somewhat unique too, because part of the sample to be enrolled will be mothers who are actively using recreational substances and who will admit to that use and allow for their infants to be assessed and studied over time, so that we can better understand the impacts of maternal substance use on developmental trajectories. So in terms of programs that are housed within the MIDB, I've mentioned a few of these so far, but I want to kind of break them down a little bit further, because there are different ways you can kind of divide up the pie and think about this institute from a programmatic standpoint. So we have programs that are focused on early detection and intervention for neurodevelopmental disorders. So these focus on children who have known conditions. So that would include things like autism. We have a group that is focused on rare diseases, so things like metabolic disorders, fetal alcohol spectrum disorder, infant strokes, and nutritional deficiencies, just to name a few. We also have programs focused on psychiatric illnesses. We have a large program focused on adolescent depression and suicidal behavior, which that whole area of work has become increasingly acute during the pandemic, both the manifestations of emotional distress, but also a need for more mental health services and research around those problems. We have programs focused on childhood anxiety and obsessive compulsive disorder, substance use, which primarily that one outside of fetal alcohol exposure or substance exposure is focused on adolescent use. And then programs focused on early psychosis. As well, we have a number of programs focused on community living. And I'm going to describe some of these in a little bit more detail next. But basically, we are looking for ways to increase community engagement, facilitate community education around developmental development itself, but also developmental problems that might emerge and kind of special cases and special needs of children as they're developing. We have an institute at the MIDB called the Institute on Community Integration, or ICI, which focuses on developmental disorders and services for young adults and younger people who are trying to integrate into community and employment settings. And then we have a telehealth and telemedicine program that also operates out of ICI. And I thought I'd say just a little bit more about that because it's a unique aspect of our facility. So there's a core, a service core that is focused on tele-outreach. And this was developed and it's supported through a grant from the Richard M. Schulze Family Foundation. And we have actually space dedicated to tele-outreach. So there's a large room, for example, with stations set up to allow the virtual encounters to take place with people, and so that it can be done in a private kind of way, but also a technically savvy sort of way. And we think that, well, this is something we're especially proud of in light of current circumstances where tele-outreach and telehealth has really gained a lot of traction in the last couple of years. There's a high demand for it. You know, obviously we're holding this meeting today over Zoom. You can just imagine, and many of you probably have experiences you could talk about the need for having clinical services that can be allocated to people through tele-outreach means. And so just one example of that I can cite would be children who are seen in our NICU, NICU follow-up clinic, where, you know, you've got these young infants, they've been sick, now we're in the middle of a pandemic, they go home, the parents are at home, maybe reluctant to come back to a busy clinic setting where there are, of course, a lot of sick people, physically sick people there in person. So these tele-outreach facilities can allow a team of caregivers to then interact with the family while the family's at home and kind of monitor the development of the child, ask how things are going, provide counseling and tips to the parents as they're learning how to work with children who have special needs, things like that. As well, this tele-outreach capacity allows us to reach rural and marginalized communities. And that's something that we are also expanding upon at MIDB. I already mentioned community connections. We want to encourage more of those. We're interested in talking to groups of people like you who can bring a different perspective to MIDB. And we're doing that through developing programs that will allow for resource sharing, outreach, sharing of services, sharing of educational materials. And also we're working on a system that will allow our space, particularly we have a space that is a dedicated community center that will allow this space to be used by outside groups such as yourselves. I don't know if you have in-person meetings nowadays, but where groups can come to MIDB and potentially use the space for their meetings and for their own events. I already mentioned ICI, but I'll say just a little bit more here. Amy Hewitt is the director, and it's an entity that's been at the university for a long time within the College of Education and Human Development. They focus on policies and practices that affect children, youth, and adults with developmental disabilities and those who receive and have a need for educational support. So the ICI works with service providers, with policymakers, employers, advocacy organizations, and families to bring necessary and needed services to individuals with disabilities. So they are part of a national network, and they're designated as a university center for excellence in developmental disabilities. So as an institute, as a standalone institute, even though it's housed within MIDB, ICI is home to over 70 research projects and 6 sub-centers that together address disability issues across the lifespan. We have a service core within MIDB that is devoted to community engagement and education. That service core is led by Anita Randolph, whose picture and email address I have included here. I had actually hoped that Anita might be able to talk with you today, but she has just very, very recently come back from a maternity leave and is just kind of getting back oriented into a regular work schedule. But she would be a person that I'd like to be able to connect your group with going forward to talk about potential opportunities for collaboration. The goal of this core, so she directs this group, but there is a group of people who are involved in community engagement efforts. The idea is to foster bidirectional communications, to identify gaps in communication between our community stakeholders and our researchers and our clinicians, and then to create a model of service and conversation and interaction that assures that MIDB as an institute is meeting the goals and needs of the community. So we want to hear from the community, and we want to know how we're doing, and we want to know what the community would like from us. So I think this kind of kind of summarizes some of this endeavor, that again, we want to identify where the gaps are, where the challenges are. We want to engage with the community and begin to, kind of have these conversations with different groups. There are a number of things that have already been initiated in this realm. Anita is an extremely energetic person, and I may have forgotten to mention, MIDB opened its doors in October of 2021. So even though our planned opening ceremony was canceled, that is in fact when the Institute opened for operation. So really only a few months ago. And what Anita has done is to reach out to about 300 community groups to begin the kinds of dialogues that I mentioned. So some of those groups are educational organizations, schools, groups that are involved in infant and preschool care and development. We're trying to organize a wellness initiative. So using some of the outdoor space, for example, to create a community garden. We are developing and sharing resources for healthy nutrition. We are organizing family nights for research participants who would be okay with engaging in those kinds of things and meeting other families similarly involved. And what we hope is that all of these kind of levels, education and outreach and wellness and research, that we can create conversations that cut across these different levels. And these are just a few of the pictures to illustrate some of these ideas. The community garden, the family fun nights, summer camps is another one. We have a research project that's launching that's for this coming summer. That's going to be it's called a creativity camp. So the research question is focused on creativity and mental health, and it's going to involve bringing kids in and engaging in a lot of different kinds of activities. And so it's going to be fun for them, but also allow the researchers to collect some data. We have a newsletter called the Synapse, which circulates each month, and within that newsletter, and we'd be happy to put anyone on the mailing list for that who might be interested. We've showcased some of our more notable kinds of research activities. So for example, in the autism research area, we have some larger scale projects going on. I mentioned the ABCD and HBCD studies. Our co-director, Damian Fair, last year won a MacArthur Genius Grant Award, which was a really special thing. And well, I think I've mentioned all of these things, just that we're hoping to emerge as a leader in the study of early development, adolescence, and then clinic prevention and intervention efforts. I just have, I think, 1 or 2 more slides, and then we can hear your questions. So we opened up during the pandemic. Because of that, the engagement within the Institute itself as a building, it's been slow getting people other than in the clinic to come and just kind of be there day to day. I've seen that increase quite a lot in the last few weeks, I think because the university has started to lift its mask mandates. But what we're striving for is over the next few months, over the summer certainly, is to facilitate culture building within the Institute. Clinically, our clinics are overwhelmed. There's a mental health crisis ongoing because of, well, maybe not solely because of the pandemic, but a lot of vulnerabilities, I think, have been sort of unmasked. And so there's a great need out there for more clinical services. So we have right now multi-year clinical waiting lists for some, not all, of the clinic providers. And then we're always looking for ways to increase our reach in the research arena. We apply regularly for NIH grants. There are other mechanisms out there that we are pursuing, and we're very much involved in education and training of the next generation of educators and scientists and clinicians. And then just talking to individuals like you allows us to develop relationships with partners in the community, with other advocacy groups, and just exactly the kinds of things that we're hoping to develop. So I just wanted to thank again our donors who so far have made MIDB and its development possible. And I think now what I will do is unshare my screen, and happy to hear your questions and talk in a little more detail. And it looks like there might be a couple of things in the chat.
Yes, there's one question already. Perhaps you can start with that one. And I'm going to close off my camera because I'm having a little instability with the internet, and then I'll just jump in if I need to. But there's one comment there, and then I just invite other people either to just, speak up. You don't have to use the chat box, or use it if you want, either way.
Okay. Okay, so I'll take a look at the chat question and start with that. And then what might be easier for me if people are able to use it is the raise hand function under the reactions link in the Zoom. But if you do that, I'll be able to see whose hand is raised, and then I could call on you. So how do we study early literacy training at home or lack of training and that association with later childhood success? Well, that's a really good question. I would have to think about whether I'm not sure that I know off the top of my head of individuals doing studies of that type right now at the university. I imagine there are studies going on, especially through our education psychology department. I don't want to say the wrong thing, but my speculation would be that people are trying to do these studies using tele outreach and virtual connections to engage with children, and then see what it is that they are able to do through like showing things on screen. And I know with our ABCD study, and I'm the lead investigator of that study here, during the pandemic, we shifted to virtual operations and we used Zoom to work with the kids who were in our study. And so we would share screen and show them visually materials on screen and ask them then to interact with us. That was how we did cognitive testing. So I would imagine that the same thing is being done. But so Mark, I think what I will do is write down your name, and if you'd like, I'll look into that a little bit more so I could provide you with a more detailed answer to that question after the seminar's over.
I would love to connect with you because I'm working on this with the Minnesota Academy of Pediatrics and other things. So this is a big deal to me. Thank you.
Yep. Okay, and then how do our programs support children who are victims of abuse? That's a great question. We do have a number of, well, there are many levels at which to answer that question. So on the research side of things, which is the area I'm most intricately familiar with, we have a number of research programs that are focused on children who have been victims of maltreatment. And so there's an interest in looking at that group of kids, understanding their needs and following them over time so that we can understand what the predictors are of resilience in that setting. So at our Institute of Child Development, there's actually a group of about 5 researchers with programs dedicated to children who are victims of different subtypes of maltreatment. So not only abuse, but also neglect. And then we also have a research program focused on children who are homeless. So that's on the research side. Of course, on the clinic side, that's always an area that clinicians are kind of on the lookout for. Anita, in terms of the community engagement core, is, I think, very interested in establishing connections with groups in the cities who are advocates for children with these very difficult histories and current circumstances. So again, what we're hoping to do is to try to be a resource so that we can share educational materials, so that we can help hone in on the best kinds of interventions, and then even get into schools and other community entities to allow those things, those interventions to kind of take hold. So it's multifaceted. Are there any studies in process related to ACEs and their influence of brain development? Could Jonna, could you just tell me what ACEs stands for?
I think she's talking about adverse childhood experiences.
Oh, thank you.
Yeah.
Well, yes. So so a number of studies, as I mentioned, all of the ones that I mentioned. Well, I mentioned we have researchers interested in maltreatment. So that's one type of adverse early experience, and several of those studies are looking directly at brain development as an outcome. So both through MRI assessments, but also through EEG and event-related potentials. There are other kinds of early adverse experiences that are relevant as well. So history of trauma is another area of interest to several members of our research community. And then there are also early adverse health kinds of experiences that children might have and that are the focus of interest. So for instance, if you are a child with a chronic illness, not necessarily a mental health condition, maybe it's a physical condition, and you have a special need, we have researchers who are focused on that. So I would say actually that this is a particular area of strength among our research faculty. And then Carol, oh, sorry.
You
Rich.
go ahead then. Yeah, please do the chats first.
Yep. So that was all for the chats. And Carol, I see you have your hand up.
Yes, hi. I have 2 children on my caseload that, unrelated, that have been diagnosed with ARFID, which I never knew till now, avoidant restrictive food intake disorder, if nobody else knows. My question is, how does that affect the brain? I found that there's a huge disconnect with OT, dietitian, pediatrician, no collaboration. Really interesting. Both of the kids dysregulate on a regular basis, affecting their social skills. So I'm wondering if that's anything that the clinic's a really interesting area. And and one of the children has only eaten 3 things in his life. He vomits if he sees anything else, blah, blah, blah.
Yeah.
Comment.
Ironically, I have 2 close friends, each of whom has a child recently diagnosed with that condition. And it's a relatively, I don't want to say completely new entity within the eating disorders clinical realm, but I think it's getting more attention now, and probably more people receiving that diagnosis now than used to be the case. And in fact, there really isn't a lot of research out there on it because there's a great deal of heterogeneity in the condition. So work needs to be done in that area. We do have a number of eating disorder specialists within our child and adolescent psychiatry program. As far as I know, I don't think that any of them have a special research interest in ARFID. And maybe that's a gap and an area where we need to encourage more activity. One of the things that I'm doing in my role is establishing a seed grant program for innovative areas of research. And so this is really a great example of the kind of thing that somebody could propose to do that as an institute we would very much then like to support. So we need better understanding.
Thank you.
I'm sorry, that wasn't, I feel I couldn't offer you something really concrete to give you an answer, but I do recognize it as a clinical need.
So we're running a little low on time. Maybe I can just jump in and ask one last question, really following up on Jana's question, because she sort of inspired it. And it might not be fair to ask you this, kind of just on the fly without some prior warning. But as you know, we're very concerned about child abuse, and what we see is a real mismatch between the timelines that adults have for resolving child protection, foster care issues, and the developmental issues that children have. So we're in the midst of a study of all the child fatalities from maltreatment between, the present going back to 2015. And one of the early things that's jumped out at us, which I think John helped to kind of surface, is that there's opportunities for parents time after time after time to address the issues that got them, reported to child protection, whether it's substance abuse or domestic violence or whatever it is. And that takes years. In the meantime, children are declining, they're deteriorating, their brain development is either being, set back, or it's their future development is being damaged. And those are permanent issues for that child. So this mismatch between the time public policy allows for parents to work their issues and the immediate impact that it has on child development and their prospects for life. And of course, looking at child fatalities, so some of them actually get killed. but many of them, there's just a long history of going through these processes. And I don't know if that's even like relevant. It's such a, it has so many dimensions to it, but that's a conversation I think I'd love to have with people, with you and other people at the Institute.
Yeah, well, that question of developmental timing is absolutely an important one. And I guess I don't want to fully speak for individual researchers in our community, but I know there are people in the mix who have the perspective that, you know, life at home is one piece of these children's lives, and of course it's a difficult piece. But if we can structure ways to intervene in other areas of a child's life, so, you know, maybe you have parents who are kind of immovable or not moving as quickly as you'd like to see happen to turn things around. Maybe there's a way to intervene at school, or through, you know, an extracurricular setting, or encouraging certain kinds of friendships. And I think we've got some research data to suggest that though even little bits of positive role models and experiences in other aspects of life, not that they can undo what's happening at home, but they can make a difference for the longer range outcomes and encourage more resilience over time. And so that's an example of something that we're interested in helping to cultivate. So I don't know if that would be part of maybe the conversation you would like to have, but
yeah, for sure. Yeah, would love
yeah.
to do that. So I don't know if you have a few more minutes for one last question. We sort of run over. I want to be respectful of your time, and if any, or if anyone has another question. So I don't see any hands raised or people waving frantically in the background. So, so anyway, this is wonderful, Dr. Luciana. I hope this is, you know, a start of an ongoing conversation. I think maybe we'd like to set up some kind of tour in the fall, because we're kind of done with our spring, with our webinar series for the year. But that would be great. I'll be there. See who else we can get to go, because I just really want to see how you've laid out that space. And I just wanted to thank you for being here, and for everybody else as well. And watch your emails to see if we are able to come up with a webinar in 2 weeks.
Well, thank you again, everyone. And Rich, if you would like to be maybe added to our newsletter list, let me know. We can definitely do that. And anytime that you all would like to pursue a tour, we would be happy to set it up, or even several small groups, you know, whatever would work best.
Yes, I would. And I'll send you an email with some of that information so we can get started. So great. Well, thank you again. And thanks everybody for coming. So we'll see you soon.
All right. Bye now.